Hello, everyone. Welcome to this technical session on how climate change fuels gender-based violence, zooming in on tools and data for gender-responsive early warning systems and effective GBV early action interventions. My name is Pamela Marie Godoy, and I'm the Regional Emergency GBV Coordination Specialist covering Asia and the Pacific for the Gender-Based Violence Area of Responsibility. We are delighted that you can join us. This session is organized by the Gender-Based Violence Area of Responsibility in close collaboration with the United Nations Population Fund, which is the lead agency for the GBV AoR. Shiva, next slide, please. I would like to go through some virtual norms of engagement for this session. So given the number of participants and to ensure that we have a smooth webinar experience and save on bandwidth, only our panelists are able to turn on their video and audio functions. We are eager to engage with you all, so please use the chat function to introduce yourselves and interact with fellow participants. We encourage you to use the Q&A function to raise questions directly to our panelists. We have two regional emergency GBV advisors, Noemi and Lee Ashley, who are monitoring our chat and Q&A windows. Closed captioning is available. You can see the closed caption icon at the bottom of your screen. Please enable that to start viewing transcription and captions. The link to the recording will be shared via the HNPW platform and the YouTube channel of the GBV AoR. Our communications officer will be tweeting from this account. Please feel free to tag this Twitter handle when you post using these recommended hashtags. As this session is focused on gender-based violence, some content may be uncomfortable, disturbing, or upsetting, so please do take care. To ensure that we adhere to our GBV guiding principles, please refrain from sharing of information about individual cases of gender-based violence. For our agenda, next slide, please, Shiva. This is how this technical session will unfold. We have a distinguished lineup of speakers. We will start off by expounding on how gender-based violence risks, including harmful practices, are exacerbated by different types of climate hazards. We will then hear from East and Southern Africa about its preparedness work, especially about the development of early warning systems for GBV early actions and risk mitigation. We'll have our first round of open forum, and then we move on to the second part of our session, which will feature field-level experience relating to GBV prevention and mitigation, anticipatory action, and forecast-based financing. And then we will have another round of Q&A. At this point, I would like to call on the Global Coordinator of the Gender-Based Violence Area of Responsibility, Jennifer Chase, to give the opening remarks. Jennifer?
Thank you, Pamela. Thank you, everyone, for choosing to join our technical session within the Humanitarian Networks and Partnerships Week. The GBV Area of Responsibility is the global level forum for coordination and collaboration on GBV prevention, risk mitigation, and response in humanitarian settings under the cluster system. The changing climate, as you know, is increasing both the frequency and intensity of natural disasters around the world, with the impact of the warming climate only accelerating. Climate change is a threat multiplier. It can intensify existing conflicts and economic and food insecurities. A few weeks ago, there was this glaring headline in the New York Times that climate change could cut the world economy by $23 trillion in 2050. For women and girls, especially those with overlapping vulnerabilities and intersecting identities, such as women and girls with disabilities and those from ethnic minorities, the toll on them of climate change can be incalculable. For this session, we will focus in on the impact of climate change on the safety and well-being of women and girls and how gender-based violence risks, including harmful practices, are exacerbated by different types of climate hazards. And since we have participants involved in food security, early warning and early action and anticipatory action, we will also discuss field level experiences on anticipatory action and gender-based violence, including working with non-GBV actors on GBV risk mitigation with regard to their early action plans. Anticipatory action helps reduce the impact of humanitarian crisis. And for GBV actors, we're hoping to maximize forecast-based decision-making to reduce risks to gender-based violence and provide earlier support to at-risk women and girls in all their diversity. And I just want to flag that we have online, I think Pamela already mentioned, that we have the interagency regional GBV advisors known as the RIGA, GBV coordination specialists, and information managers hosted by UNFPA in Asia and the Pacific, East and Southern Africa, West and Central Africa, and Middle East and Arab states. We look forward to engaging in the discussion with all of you moving forward. Thank you again for attending.
Thank you, Jennifer.
Yeah.
Thanks, Jennifer, for providing the context for this technical session. To start, I would like to call on Jean Ward, the GBV technical expert and the main author of the GBV AoR Help Desk piece on GBV and climate change, and Emily Krasnar, the GBV and Emergencies specialist from UNFPA. So over to you, Jean and Emily, to start off our presentations. Thank you.
Thank you, Pamela. So I'm going to kick us off and then Emily is going to come in. We really appreciate this opportunity and are so happy to see so many people with us today. I'm going to start with the basics. What is climate change? So climate change describes the increasingly extreme variation of long-term average weather conditions worldwide. Climate change specifically refers to the effects of greenhouse gas emissions caused by burning fossil fuels like coal, oil, and gas, resulting from industrialization, as well as deforestation, fertilizer use, and livestock production to feed and house our growing societies. Greenhouse gases concentrate in the Earth's atmosphere where they absorb and emit the sun's energy, causing the temperature of the Earth to steadily rise. When the atmosphere warms up, it collects and retains more water, impacting weather conditions and making dry areas drier and wet areas wetter. In addition, a hotter Earth means that oceans warm and expand and snow and ice diminish and sea levels rise, causing this feedback loop that increasingly exacerbates these negative effects. The change, as Jennifer noted, has already had a dramatic impact on the Earth's climate. Higher temperatures resulting from climate change have worsened natural disasters. Before we talk about that impact on women and girls, I want to first describe to you how we characterize typically these natural disasters. Usually they're characterized in two ways: slow onset and rapid onset. Slow onset means that disasters that are years in the making, they can be difficult to notice until it's too late. As decades and decades go by, a climate may become steadily more inhospitable to the population that's been living in it for centuries sometimes. So for example, projections suggest that by 2070, up to 19% of the Earth's surface concentrated around the equator could have an average temperature equal to the hottest part of the Sahara Desert right now. So illustrating the issue of slow onset are events like droughts and sea level rise. And then we have sudden onset disasters, and those describe the more acute emergencies generated by rising global temperatures, which impacts the frequency, intensity, duration, and timing of extreme weather events like hurricanes, flooding, wildfires, and heat waves. Although sudden onset disasters are more discernible than slow onset events, they may be just as, if not more, destructive. Next slide. just to give you a sort of this is in the paper that Pamela referred to, but just to give you some kind of immediate indication of climate change. In 2019 alone, 97.6 million people were impacted by 308 disasters triggered by natural hazards, 77% of which were the result of events exacerbated by climate change. 33.4 million people became newly displaced, 70% of whom were displaced due to climate disasters. And we know, and we'll talk more about the fact that women and girls in developing countries are especially affected. Even though climate change will touch every region of the world, its impact will not be the same. Countries in the global south are generally more exposed to climate change related hazards. Those countries are, the countries that are better able to adapt to climate change will suffer less. Higher income countries experienced more disasters from 2004 to 2013, and yet they experienced less mortality related to disasters. Researchers estimate that more than 3 times as many people died per disasters, more than 3 times, I just want to emphasize that, died per disasters in low-income countries compared to high-income countries. In many disasters, these deaths were significantly higher among females. One often cited statistic is that women are 14 times more likely to die or be injured during a disaster than men. 14 times more likely. Next slide. So the IFRC projects that the increasing frequency of these climate-related events and the acceleration of disasters, that 150 million people annually will need humanitarian assistance related to climate change events by 2030, compared to 100 million now. So you can see the humanitarian impact that climate change may wreak. Next slide, please. So just to reiterate, climate change is going to affect everyone on Earth, but the effects of climate change are likely to be more devastating on communities that do not have the resources to adapt to a changing climate. And within these communities, we can expect women and girls to be the most affected, as has been the case already in many natural disasters around the world. Climate change creates chronic and acute stressors which exacerbate or amplify pre-existing GBV risk factors for women and girls, such as poverty, rigid gender roles, personal and community conflict. Now, Emily is going to take us through some of these risk factors now. Over to you, Emily.
Thank you, Jean. Next slide, please. So I think everybody has seen this before. This is the ecological model for understanding violence. As Jean said, I think it's very useful to use this model to describe women's ability to adapt or not to adapt, and also their increased risk due to climate change. It also helps us understand some of the norms and practices that may increase their vulnerability. And it's also useful because it's organized by on 4 levels: the individual level, whether she's a woman or girl with a disability or adolescent, their age, their relationships, the community level, and the broader societal level. It underscores that in order to develop strategies for reducing or eliminating risk of violence, it's good to understand the interplay of these sort of biological issues, psychological issues, social, cultural, and economic issues, and also the larger societal and political factors and how they interact across these levels, and how they exacerbate women and girls' risk of exposure to violence, as well as men's likelihood of perpetrating violence. Next slide, please. So here I'm just going to expand a little bit on these 4 levels and highlight a few of sort of the common issues that might be common across regions that are sort of context-specific risk factors for women and girls. At the individual level, we're really looking at skills and assets affecting a woman or a girl, and talking about, you know, what it really affects their personal resilience. As I said, of course, there's age, there's educational status, disability, but also access to, as I said, assets, like lack of access for women to credit or insurance to assist with recovery, less experience or skills or education level that could mitigate risk, or actual skills like climbing a tree or swimming, as we saw in the tsunami. And then also just dependence on natural resources, making women farmers particularly vulnerable to climate change. In terms of their relationships, their domestic responsibilities, including caring for children. These are issues that might make flight during a disaster particularly challenging. And also just low socioeconomic status at the household level, and including having to go farther to get food or to get water, which each of which are impacted by climate change and might indeed increase GBV risk. At the community level, we're looking at gender discriminatory education systems and social norms that, you know, might indeed increase or become more conservative in the context of conflict or climate change. Weak communication or early warning systems that don't target women and girls is another one that we've seen. High unemployment and gender discriminatory employment practices relegating women to the informal sectors. And it's these informal sectors that are often less stable to shocks. And then on the sort of societal level, of course, we have, you know, discriminatory laws and practices related, and then also disaster risk reduction policies that might not include a gender analysis and be inclusive of women and girls. So this is just sort of a sample of some risk factors that speak to many regions across the 4 levels of the ecological model. Next slide, please. So just talking a little bit more about sort of these pathways that Jean introduced, the slow onset events and acute disasters. With slow onset events, you know, such as drought, where, you know, it indeed might be, you know, years in the making, these are exacerbated by climate change, and these can increase levels of GBV in a variety of ways. Evidence suggests that communities under stress may adapt more conservative or customary patriarchal practices. In addition, extreme stress, such as property and communal loss and scarcity of food and water, can contribute to community conflict over resources and increase incidence of violent behavior by men, including GBV. Even in some cases, workloads for women and girls may mean they're not able to be as responsive to the domestic demands and might increase tensions in the household, make them more vulnerable to sexual assault, having to walk farther distances for potable water or food, a long list under slow onset events. Also increased risk of SEA if they are seeking humanitarian assistance. There are also practices where families are unable to meet their basic needs, and there has been an increase in child marriage or other harmful practices. So this is sort of where the protective factors, such as, you know, keeping girls in school, might fall away. Also, many of these are also real and, you know, have been documented for acute disasters, such as flooding, cyclones, wildfires, and they can also contribute to GBV. In addition, displacement caused by these events can increase the risk of exposure to GBV in transit centers and in camps. Poorly designed relief efforts, you know, can compound risk. A study of the humanitarian response effort in Samoa following the cyclone of 2012 found the unequal distribution of supplies created community tension, leading to a risk of IPV. So these are, you know, what is brought on by an acute disaster. And then there's also the issues of sort of bad planning or poorly designed relief efforts without engagement of women to girls or without aid delivered safely. So these are just some links with the different, with slow onset and acute. Next slide, please. This by no means is comprehensive. The paper is great, so please read the paper. It goes into sort of a short lit review of the links by region. So it's set up in a sort of a very useful way for you to sort of define the links in terms of your region and what's been documented there. So I think it's very useful. But just sort of a few little takeaways here. I would say one of the key takeaways is that climate change has differential impacts on regions, exposing women and girls to different forms of GBV across different settings. But I must say that gender inequality and that its ability to sort of fuel and increase risk is really, one of the main driving factors here. For example, 5 out of 8 participants in a study in Namibia noted that transactional sex had occurred in their communities because drought made food insufficient and women needed to provide for their families. GBV risks in Arab states region, FGM, sexual violence and child marriage are prevalent. Somalia drought and flood conditions in 2019 caused displacement of 2.6 million people. There's also examples from North America and Latin America. And then in East Africa, slow onset climate events such as widespread drought and ongoing famine directly linked to climate change have increased risk of GBV for women and girls. Also, we don't really have it on here, but just want to highlight how ERC Mark Lowcock has really tried to spotlight the Sahel. He's called it the epicenter of climate change, partly due to the pronounced gender inequality there. And so there's, really sort of a focus on the Sahel in a lot of that work there. Back to you, Jean.
Sorry, everyone, my fire alarm went off. I'm not sure if you heard that shrieking during Emily's presentation. So just very briefly, we're not going to go through all of these approaches and frameworks, but I just want to call your attention to them. And Emily's going to talk a little bit about one in particular that's new and exciting. So we have disaster risk reduction, preparedness and contingency planning, climate change adaptation, resilience, and anticipatory action. All of these, well, many of these are overlapping. They all have very sort of specific priorities for action that can help us as GBV actors to think about how to improve our attention to GBV prevention and response related to climate events. But one of them that's really exciting is this last one of anticipatory action. And I'm going to turn back to Emily to let her tell us a little bit more about this before we end our presentation.
Thanks, Jean. And I'm also going to just provide a brief intro to this framework because Rumana will go into much more detail with a country example later. So anticipatory action is, I don't want to say it's necessarily new, but it's really a way of using evidence of risk and to, further define interventions and to make sure that aid is provided before a shock and that the resource mobilization efforts are in place to manage risk. So it's really dependent on data and forecasting to function as a trigger for this prearranged financing and prearranged intervention. So of course it requires some planning. And as you can see from not the traditional response, but the anticipatory action, the second picture, the aid is provided before the shock event and the forecasting and the action planning and the prearranged financing happens before that. So in terms of sort of, a takeaway, for those on the call, I think it, really requires sort of a meeting of the minds and, taking advantage of some opportunities of GBV and protection actors really, speaking, to other actors such as food security, which is often implicated by anticipatory action, so that the risks and the protection risks are also included in anticipatory actions. Because I think to date, this is focused on food security and nutrition, and there's an increased, there's a need for more gender analysis in this work. Next. I don't think I have time to go through all of these, but I think we're going to touch on some of these in the Q&A. And also please look in what we're calling the key considerations in the AoR Help Desk paper. These are some of sort of the pieces to look at moving forward. Policy, investment, risk mitigation, response and coordination. There's some key takeaways here, such as GBV actors should take advantage of entry points to influence climate change policies and national action plans. And this has been proven to be really beneficial in places such as Fiji and Malawi. Greater investment and system strengthening related to GBV within global, regional, and national climate change plans. And then, of course, further investment and engagement with women's organizations and groups. Risk mitigation using the GBV guidelines, the ISC GBV guidelines, within other sectors doing climate change work. And then climate change adaptation approaches and anticipatory action, ensuring safe services are available for survivors, either through slow onset or acute climate-related emergencies. And then coordination, addressing GBV and climate change, supporting the coordination mechanisms as an essential component of building systems. I can go on for longer, but I think we're going to touch on some of these in the Q&A, so I'll pause there.
Thanks, Emily. Thanks, Jean, for that excellent presentation. We'll have a few seconds of sensory break before we proceed to our next speaker. Okay, I would now like to call on Jessica Gorham, the Regional Emergency GBV Advisor covering East and Southern Africa. Jessica, if you can share with us how the Regional Gender-Based Violence Working Group is strengthening its work around preparedness and how it plans to build on early warning and forecasting mechanisms to inform the work of both GBV actors and GBV coordination mechanisms. Over to you, Jessica.
Thanks, Pamela. I will try to do that in 10 minutes. As Pamela said, my name is Jessica, and I'm the Regional Emergency GBV Advisor for East and Southern Africa. And I'm sitting in for my colleague, Christine Appio, who is the GBV specialist here in East and Southern Africa on our team, who focuses specifically on preparedness. And we'd like to also thank NORCAP because they're the ones that saw the vision of this post and supported her her deployment. So we do appreciate that. Fortunately, she's on maternity leave, so I am covering while she's out. But just to note that a lot of what I'm talking about today is based on concepts that she developed. So thank you to Christine, and I will try and represent on her behalf. Next slide. So here in East and Southern Africa, obviously we have lots of conflict-related crisis, which the AoR is actively engaged in. But what we also realized is that a lot of countries, particularly in Southern Africa, were experiencing crises through climate-related cyclical natural disasters. And so in order for us to do the work that we need to do in countries like Malawi or Zambia, and even up in Eastern Africa and Kenya, we needed to look at this in a little bit of a different lens. And so from a preparedness perspective. And I was glad that I'm following Emily and Jean, because a lot of what was brought out in that report is sort of what we're trying to put into action. And so we're at the beginning phases of our engagement. And I know you'll hear from our colleagues in Afghanistan and other countries where they're a little bit further along, but we hope that our experience might also guide perhaps some of you in this work. And we're really interested also to hear feedback from you as well. So for us, again, we're very fortunate that we're able to do a pilot project on gender-based violence in emergencies. Particularly, it's a preparedness project. And it's really to look at, to prevent gender-based violence from happening, to mitigate potential GBV risks, and then ideally, it will also present a more coordinated response at the onset of the crisis. And we've targeted 4 countries for our pilot project: Malawi, Zambia, Mozambique, and Kenya. And we specifically targeted Malawi because they are also part of the Anticipatory Action pilot project that OCHA has also rolled out. So there's lots of overlapping sort of initiatives going on. And so again, we chose these 4 countries, but there are many others. We know, for instance, that Angola is experiencing one of the most severe droughts that it has faced in decades. What's going on in Madagascar right now, worst drought in decades, risk of famine. So our hope is that if we can get it right in these 4 countries, we can then expand to other countries in our region. And then the idea would be that if we can, go in from preventative, from the preparedness perspective, that ideally, then it wouldn't go on to a full crisis. So I'm going to specifically focus just in these 10 minutes on our initiative, which is developing early warning indicators. So we were using, the plan is to, and this is what we're sort of in the midst of doing, is utilizing existing early warning and forecasting mechanisms to develop a set of early warning indicators for gender-based violence. And I think Emily had mentioned that food security and nutrition are 2 very complementary clusters in terms of vulnerabilities, because many of the vulnerabilities associated with food security and nutrition can be directly linked to various types of gender-based violence. And it often is related to these existing inequalities. And an example of that would be just, for instance, household level food consumption. When you look at the availability of food and then also the utilization of that food. And so the idea would be also to promote the implementation of early action in response to these early warning indicators. And as we know, for instance, when we look at household level food consumption, just by the sort of cultural and social norms across our region, regardless of the context, whether a country is experiencing drought, whether they're in a development phase, a humanitarian phase, a conflict phase, women and girls are still expected to carry on these activities, which is to gather food, and then also they are also responsible for preparing food and all that entails. So this is why, again, we're focusing on these 2 clusters or sectors, but then we hope that we can expand further. So how does this look in practice? As I said, when Emily had presented that sort of framework, this sort of sits in the forecasting and decision-making model. So right in the beginning of this. As I said, how does it look in practice? So we are using, this is just one example, but the example is using the integrated food security phase classification. And so we would look at phase 2, which is considered stressed, right, as an early warning indicator for gender-based violence. And how they describe this phase is households have minimally adequate food consumption, but are unable to afford some essential non-food expenditures without engaging in stress coping strategies. So when I read this description, it sets off some warning bells for me, right? What are the GBV risks that would be associated with this sort of stressed phase? And what's really great is that the food security sector has a really well-developed system. And so that ideally we can feed into that existing system. So some of the words that sort of jump out at me from this stressed phase is minimally adequate food consumption, right? We know from that previous slide that when we look at household level food consumption, that really is the responsibility of women and girls, regardless of the context, whether we're facing a drought or whether we're, you know, what we say kind of in normal times. So that's increased risk for me. And then also another kind of red flag for us is unable to afford some essential non-food expenditures. And this immediately makes me think of things like, you know, sanitary pads for adolescent and adult women. How are they able to acquire those products? You can't live without them, but how do they in fact get them? And so these are some of those things. And then when you look at stress coping strategies, we have different language sometimes in the GBV sector, because I've heard many things like emergency coping, crisis coping, stress coping. And for us, again, that triggers this next circle, which is those gender-based violence risks. So ideally, we would then identify those risks. Unfortunately, many times those are universal across countries in our region, but it would be contextualized for each context, of course. But as I said, unfortunately, there's a lot of commonalities. And then that would trigger early actions. That's the idea, right? I was in a conference once and it was led by UNICEF in Madagascar. And the speaker said, for every dollar spent on preparedness, you save 7 in the response. That's good money, right? And that's good for us. As the least funded sector in all of the humanitarian sphere, this makes sense to us. If we can predict with more accuracy, then ideally we can get funds earlier and help, as we said, prevent, mitigate, and then also have a more coordinated response at the onset of this crisis. So then we look at, as I said, early actions. But we have to look at early actions from both a GBV actor perspective, so GBV specific programming, and then we also have to look at early actions from those 2 essential sectors, food security and nutrition, since we realize, as I said, many of those vulnerabilities directly link to gender-based violence. And so through this project, we would like to build up those relationships, but then also go beyond it. So I've just sort of introduced what we're doing along early warning indicators, but of course, Christine is also working on systems change, as Emily mentioned in Malawi, looking at how can we integrate into policy. And then the second phase of that project is also actually going into communities and then looking at how we can, with these early actions, how can we engage and mobilize and support women's organizations, which are really women-led and women-focused organizations who are really at the forefront of GBV prevention at community level. How can we make sure that they're also at the forefront of this? With these early actions and looking at strengthening referral pathways and others. So coming back, we have someone I saw in the chat said, how are there resources out there that can help us with that? Next slide, please. There are. We here at the GBV AoR, we have been looking and working on these issues for a long time. We have the guidelines for integrating gender-based violence interventions in humanitarian actions. So this is a set of guidelines that specifically identifies GBV risk mitigations for every sector that we see in humanitarian. It says humanitarian, but we also look at what we can do from a preparedness phase. And that would also include anticipatory actions and early actions. We also said that it's really important for GBV actors to be engaged in this process, this, I'm going to say preparedness, but we know it includes anticipatory actions and then leading to early actions. So we also have the interagency minimum standards for gender-based violence in emergency programming. And for each of these interagency minimum standards, we do have a checklist for preparedness actions. And many of those we could reframe as early actions. And so these are two great resources that, again, you'd have to reframe and contextualize, because I know it says humanitarian emergencies very, very loudly on those titles, but we can do that because I think everything that's provided in these resources is quite practical and it can easily be transitioned. So I will stop there, but I do have, I know I have I might be a little bit over time, but so three takeaways from our side. One is that I know we have a cross mix of people on the line. One is that we need to have GBV actors trained on some of these early warning systems and networks that have been developed by food security and our nutrition colleagues. And once we have that, I would love for us to also extend into education and WASH and some other sectors as well. So that's one ask. Second, we were also, particularly in my region, if you are based in the East and Southern Africa region, or if you're interested in engaging further on this, please, because we are still in the development phases, we would love to have a cross sector of individuals or specialists who could review our hazard specific proxy indicators. We're doing pretty good. We have UNICEF, UNHCR, UNFPA already sort of on our task team looking at these issues, but I can tell you we're very GBV focused. And so it would be great if we had some colleagues from our other sectors. And of course, we're reaching out to others. Sorry, I should have said we have WFP on there as well. And then third, our ask of you from other sectors is to please reach out to us at the regional emergency, at the regional GBV working group, if we can help build capacity around that concept of risk mitigation in your sector. We do this a lot and we can help manage and help facilitate that as well. And I think our contacts will be provided. But thank you very much for having me. And if people have questions, I'm more than willing to answer those at the end. So thank you. Over to you, Pam.
Thanks so much, Jessica. I'm going to jump in now with some time for questions and answers. Thanks everyone for posting your questions in the chat and the Q&A, and we will try to address as many as we can. Some have already been posted, some information in the chat, and as has been mentioned, there are some resources that have been shared, and also the recording that will be shared, and the product that has a list of resources as well included. So before we kind of open up to our panelists for discussion, just a couple of quick mentions of elements that have come up in the chat and the Q&A in terms of terminology and linkages. So just making the link around natural disasters and terminology that while the hazards can be natural and maybe can't be avoided, that the results of hazards are brought about by the decisions and the way that we address or don't address, as the case may be, the risks and the potential impacts of those hazards. So thank you to one of our participants for sharing that information and that just reminding us of that focus. And also we've had a few kind of mentions in the chat and in the Q&A on the broader focus beyond climate change, connections to other environmental degradation and loss of biodiversity, and the importance of integrating or considering these elements, as well as the link across the development and humanitarian and across the nexus, and the importance of taking that longer term view. So again, we had a couple of participants posting resources in the chat, and thank you so much for those. Again, we can make sure that we share those with recordings of the session. So I think Jean also posted some information about that, or the focus. The recommendation is very much that GBV and emergencies actors engage with development actors focusing on climate change, so that we're looking across and that we're not siloing those efforts. So again, thank you for keeping that on our minds. So one question, just again, in terms of, I guess, terminology or making kind of clarification that I want to open up first before we dive into maybe a little bit more substantive, is the one question raised on what is the difference between anticipatory action and preparedness and contingency planning and disaster risk reduction? So I wonder if I can throw that to Emily or Jean or Jessica, if anyone would particularly like to respond to that question in terms of the distinctions.
I'm happy to give it a first go, if that's helpful, and then maybe other people can jump in. One of the critical differences in anticipatory action from, say, disaster risk reduction and preparedness and contingency planning, which is a component of disaster risk reduction, is funding. So SURF does not fund disaster risk reduction, but they will fund anticipatory action. And so that it makes it really important for GBV actors to understand the or even more important for GBV actors to understand the distinction between anticipatory action and disaster risk reduction. The anticipatory action actually is less about the planning and more about the action that can be taken in real time prior to an emergency in order to reduce its impact. So it's not the process of developing a kind of plan. It's more about the focus on the activities that can happen in advance of the emergency in order to mitigate the impact of the emergency. Other colleagues want to jump in on this one? Okay, let me just say then one more thing, which is, as I mentioned, all of these kind of frameworks, disaster risk reduction, preparedness and contingency planning, resilience, these are all laid out in a little bit more detail in the paper, but they're all overlapping, and they share many of the same kind of objectives overall. So it's a really good question to ask what the difference is. When I started writing this paper, I myself was asking that same difference. And I'm glad you've raised it. But understand there are different funding opportunities for anticipatory action, and also it speaks very specifically to actions that are taken prior to the emergency that can mitigate the emergency.
Thanks so much, Jean. Next, I'm going to pass to Jessica to just say a little bit. I think you touched on this in your presentation, but we've had a couple of participants on the call raising needs of other countries in the region, and particularly Somalia, and the benefits for others of also being part of a process such as this pilot. Could you speak a little bit to, again, you already mentioned, but to kind of what you would see as further potential for this beyond what's happening at the moment?
For sure. As we said, this is a pilot project. I mentioned one aspect around anticipatory action, but the idea is for us to do also systems change engagement with, I say we, and that's Christine, and working at country level with her counterparts. So yes, with this particular piece, we will be engaging with the other countries in our region who are piloting the anticipatory action framework. which includes Somalia and Ethiopia as well. But for the broader project, just in terms of being able to pilot, in a sense, we did select 4 countries that are really looking at cyclical natural disasters. And Mozambique is a unique case because we also wanted one that straddles this sort of nexus as well in many different ways. And since we started the project to now, it's evolved a lot more in Mozambique. So we didn't expect it to blow up as much as it did in the past couple of months. But we chose a variety of countries for different reasons so that we could get the experience. And then for a place like Zambia, for instance, which is very much led by the government, the coordination group, we would have a set of experiences we might be able to use in another country with a similar context. Malawi is the one country that is piloting the Anticipatory Action framework. So we expect to take our learnings from there and then also to share those with Somalia and Ethiopia. Mozambique, as we said, is the one country that also has a cluster system that's active in certain parts of the country. So we're seeing how we can, I saw a question in the chat, how does this cross over to humanitarian? And I think those, how that's rolled out in Mozambique will look slightly different because of that. And we'll be able to take learnings from Mozambique a little bit differently than, say, the other countries. And then Kenya, which is sort of a middle income country for us here in East and Southern Africa, how does this look there? And can we extract that and then look at other countries with a similar profile? And then we can take the learnings from that. So the idea is that this could even go beyond East and Southern Africa, ideally, right? That these learnings would be applicable to many other, and to be honest, a lot of how we formulated this came from a study that was done in Latin America. So there's a great report that UNFPA did, a regional report on climate action. And yeah, we took a lot of what their learning practices were, and certainly they need to be contextualized, but we saw a lot of commonalities and we expect to see that as well. And I can also say we're working really strongly with our Asia Pacific counterparts, particularly Pamela, who's running this session, because they are in many ways more advanced than we are in our region. I say that, maybe I'm being naive and others would say, no, we're doing really well. But I do think that they've been dealing with this at more of an advanced rate than maybe we have. So we've taken also a lot of learnings from them as well. Over.
Great, thanks so much, Jessica. And you also answered another question that someone posted into the chat about expanding beyond even the region. So thank you. So I will just then pass over to Jean and Emily. I think, Jessica, you all already addressed a little bit at the end of your presentation the top takeaways, the top asks that you would have kind of across the different areas of work in this. And I'd like to ask the same question to Emily and to Jean. If you had 1 or 2 top takeaways for GBV colleagues on the call, what would they be in terms of focus, in terms of recommendations? And on the other side, if you had 1 or 2 top takeaways for those working on climate change or disaster risk reduction or food security or any other area on the call, what would they be? Sorry, go ahead.
Okay, thanks, Selma. Key takeaway, I'm going to be very brief with time. One of them I put in the chat, just to sort of remember the core global guidance on addressing GBV in humanitarian contexts that are also quite relevant when we think about climate change. And then also a takeaway for GBV actors would be, you know, of course, I mean, I guess this is for GBV actors as well as DRR climate colleagues, would be, you know, of course, to ensure participation and institutional representation of women-led organizations in these, you know, policy making and, you know, risk analyses related to GBV and climate. Also just that we do not want the conversations of climate change and DRR actors to, and climate change and GBV actors to be so separate. So we really would love to see climate and protection actors forging opportunities for meaningful conversation and collaboration so they can, you know, focus on the more substantive issues, you know, such as integrating economic empowerment for GBV into SOPs, promoting cash distribution, strengthening coordination structures, monitoring continuity of services, you know, within, you know, sudden onset disasters, and these things can be done together. I'll pause there.
Great, thank you. Jean, anything to add as we wrap up?
Sorry, just took myself off mute. That's where we wrap up. Thanks, Emily. Thanks, Tama.
Great, thanks so much. Pam, I'll pass back over to you.
Thanks, Shiva. Thanks, Tema, Shiva, for our sensory break. So we'll have a 10-second sensory break just so we can ease into our next session. Okay, next slide, please, Shiva. So now moving on to the South Asia region, we have our panelists from Bangladesh who will share field level experience about their work on gender-based violence prevention and mitigation in relation to anticipatory action and forecast-based financing. So we have with us Farah Kabir, the Country Director of Action Aid Bangladesh, and Romana Khan, the Gender-Based Violence Coordinator with UNFPA Country Office, Bangladesh. So let's start with Farah. Farah, you've been working in development and humanitarian assistance for nearly 3 decades. Please provide a brief overview about the policy and mindset shift from reactive responses to anticipating humanitarian needs and acting early. And also, if you can share field-level examples on how Action Aid has been able to ensure that early warning systems are understandable by community members and anticipatory actions can reach women, adolescent girls, and other groups with intersecting vulnerabilities. Farah, over to you.
Thank you, Pam, and good evening, good afternoon, good morning, where you are. I just want to have a couple of, I have a few slides, and I'm talking about Bangladesh. So just want to give you a little idea of Bangladesh if you haven't been here or if you don't know what the situation is on the ground. So the next slide, please. Bangladesh is a delta. It's a lower riparian. It's at the bottom of everything that flows from the Himalayas ends up through India to Bangladesh. So it is a very low-lying, flat-plain country, and constantly all the history, literature, movies will talk about floods and river erosion and displacement, but in this small piece of land, which is Bangladesh, it has a population of over 17 million, 170 million, and half of that is women. So you can imagine, and the land mass is very small, and there's river all around. Basically, we have 3 major river systems, and that has led to multiple floods. But with the climate change being, as we understand and we learn from it, we see how it has changed the climate, the weather, the frequency, the intensity. We have all multiple hazards here. We have river erosion, we have salinity increasing. Can I have the next slide, please? So if you are in Bangladesh and if you want to work whether it's from the development perspective or you want to change, grow economically, it is not possible to do without understanding the climate and the disasters and the risks that we are in. Now, one thing before I get into that is that Bangladesh is known now for its remarkable progress in terms of women's lives. Infant mortality has gone down. If you look around South Asia, we have made many, we have achieved a lot. Women's contribution is economic development because we are known for the ready-made garment sector, the apparel sector, and the economic contributions. Women's in politics, as you know, we have had since 1991 women prime minister and women leading. And the number of women in leadership is also, and women are in every sector. Now, women's capacity and contribution sometimes we feel is not fully recognized because the society is still patriarchal. There's still differences based on your gender. And in the informal sector, the wage differences is still very strong. Then the practices in terms of rituals or religious interpretation, these are heavily patriarchal and not women friendly. And poverty, there's a feminization of poverty. Just as that is true, it is also true in the last 50 years, there have been numerous legislations, and the women's movement here in Bangladesh is very strong. It keeps challenging the establishment, it keeps challenging the different political actors. But it's these two contradictory forces at work: patriarchy, inherent discrimination because of legislations, feminization of poverty, and then disasters, and which are now induced by climate change. Next, please. Now, in our work, like ActionAid is a human rights-based development organization. The moment I took on, I realized that all the development interventions, all our years of capacity building, learning, campaigning, gets washed away within seconds because of some disaster. And these disasters are increasing. In 1 year, we have had 4 or 5 rounds of floods. I joined in June of 2007, and by November, I had 2 rounds of floods, avalanche, then the major cyclone Sidon. So it made it very clear to us that we have to look at the whole scenario of disasters, disaster preparedness, which we were already doing, but also understanding the link between climate change. And the initial piece of work was about adaptation. And the society and the community was already doing a lot of adaptation. And this adaptation, absorptive capacity, there was investment there. But there's a limit to adaptation. And in fact, sometimes it was frustrating because sometimes it was maladaptation. And the gender dimension there was missing. So we started working closely, because the signature for ActionAid is women-led emergency response, women in humanitarian response. And by bringing the women's groups together, women in any of these communities, they started mapping out what are the resources they have, where they are being impacted, what are the structures and that they should be working with, who are the local leaders, because prior to our intervention, they did not have sufficient information. There was no early warning for them. The early warning system worked in a way where it was mainly targeted for men, or it was mainly targeted for fisher folk or other people, but not necessarily for the women and the girls in the community. And this is where, by working with the women's group, we started bringing in, they did a mapping of the resources they have, then linking them with the local administration. And, I will tell you an interesting story that year it was also Ramadan, and the embankment in the coastal areas in Kuakata would keep breaking, and the water board would not fix it, or fix it in a kind of a hurried way, didn't do sufficient work. So this women-led group came to the embankment, sat on the embankment during Ramadan, and because by now they were aware of what was happening, how they were being affected, they sat on that embankment and silently protested with the local authorities, saying, you have to take action, and we want to speak to the Prime Minister. Otherwise, we're not going to go away from the embankment. So ultimately, they had to connect the women leaders with the Prime Minister of Bangladesh, and they told her that we're not asking for charity. All we are asking you tell the water board to fix this embankment before the next floods come, because we don't want to be displaced and we don't want to move from our home and lose everything. And she did, and the local authority had to act on that. So the understanding, information, the confidence and awareness, this capacity building helped them to take this up with the local administration. Next, please. And as we progress from 2008 onwards, we came to understand what were the needs of the women and the girls. When I went into the Rohingya camps in 2017, after the refugees moved here, realized that the young girls and young women were missing. They were not being able to come and take the relief, relief packages and so on. Why? Because no one had prepared the dignity kit for them. They had not made those water and sanitation arrangements, and they were therefore trying to keep themselves far from the rest of the groups. So we put on our agenda the need for dignity kits, because this is something that women need every month. Every girl, every woman of a certain age needs it, and this has to be provided. And sadly, we are talking a lot about GBV, but within communities, there's still discrimination, inherent discrimination. In 2008, when we tried to bring the sex workers into the shelter, the rest of the community would not allow them. Even when they were all in the same risk, same level of vulnerability. So we had to rent a separate place and then move 128 of the sex workers because of the social taboo and discrimination. It's very sad that even in a situation where we are also vulnerable, we still have our prejudices and we continue with them. So this meant for development organizations like ours to invest in awareness raising, in trying to help get over some of these prejudices. Okay, next slide. And so I think over 10 years or so in Bangladesh, we see a lot more anticipatory action. We are seeing women engaging with local decision makers. And Bangladesh is known for its climate vulnerable forums. It is global advocacy and campaigns. And this has happened over 10 plus years because of the investment in women leaders in communities. And I think that today there's more confidence in women leaders at the community level to address their situation and to come up with long-term solutions. There are many other examples that I can give, but I will move to Romana, who will be speaking from the UNFPA experience and GBV. So over to you, Romana, and I'm there to take any questions. It's very difficult to explain or share decades of experience and amazing stories. Romana.
Thank you, Farah. Please go ahead, Romana.
Thank you, Farapa and Pamela and colleagues from the other parts of the world. Good evening from our side, good afternoon, good morning to different colleagues in the different parts of the world. As Farapa was explaining to you the situation in her slides, how vulnerable Bangladesh is to floods. And you can see in this slide, the situation from last year. So what I would be sharing with you is how UNFPA Bangladesh with its partner organization and many other organizations in Bangladesh has focused on anticipatory action in addressing gender-based violence in monsoon flood 2020. So just before I get into the lessons of last year's anticipatory action, I would just like to highlight what Emily was defining as anticipatory action. The three key elements of anticipatory action. One is definitely the country has to have a very robust forecast modeling system. Second, you have to work on a pre-agreed financing mechanism, and the third, pre-agreed action plan. That's how the anticipatory action framework of OCHA is defined with these three elements. So, and that's what we sort of picked on, and 2020, as you go into the next slide that you see, in 2020, when we have flood in the northern region, there were a couple of, this was Bangladesh has experienced, or has started implementing anticipatory action from from 3-4 years from now. There are many partners like CARE, Start Fund Network, who are engaging in anticipatory action, but in sectors like food security and nutrition, or even shelter. However, in addressing gender-based violence, last year was the first time that Bangladesh, we piloted this approach. So what we have learned, I think what we have fundamentally learned, and this was also a message conveyed by the Emergency Relief Coordinator, is the shift, which Farapa was also indicating, is the shift from looking at this as a rights-based approach. When we are doing anticipatory action, we really have to invest in a risk-informed action. Unlike traditional response, where you actually observe, the situation unfolds and you assess the needs and you mobilize resources, whereas the process of action starts way ahead of or way before the disaster. So that's the shift that we are indicating as from welfare to rights-based approach in humanitarian action. And the second point when we are looking at it is the dignified approach. I mean, you're not necessarily waiting until a person is affected by the disaster. The shock has put the person in distress, but you are assessing vulnerability and exposure of the individual, and then providing some risk mitigation support. The other element of anticipatory action or risk mitigation is unlike when we are doing risk reduction in development, that doesn't necessarily wait or that doesn't necessarily depend on any early warning system, right? So this is mitigating imminent risk that is specific to a disaster and in relation with space and time. So this is the major difference. If somebody had asked in terms of anticipatory action to risk reduction, that would be perhaps one of the major difference. When we are undertaking forecast-based anticipatory action, which has in the past traditionally been, as I said, in food security and nutrition sector, there was a very dearth or a lack of analyzing the situation from a protection or gender lens. So anticipatory action, when we are sort of supporting women and girls and other marginalized group ahead of the shock, it's facilitating their access during the emergency time. So that's what we have observed from our last action. Of course, the 2020 experience also tells us that, engaging, these these models of early warning or forecast models, these are very scientific and very critical and essential. However, we also realized, and we heard from our monitoring visits from last year, is we really need to sort of validate these analysis and risks with the community. So engagement of communities in this steps is quite critical. I would, the last 3 points on the slide is actually taken from what Mark Lowcock sort of conveyed, or through his visit, we sort of summarized, is basically 4 issues. One is changing our mindset. With anticipatory action, we're trying to change our mindset in terms of speed. We are also trying to change our mindset in terms of maximizing people's ability to solve their own problem. We are also, looking at innovation in humanitarian work, right? And finally, last but not the least, we really have to invest a lot. What we learned from last time is we really have to invest a lot in evaluating this approach, so we have more evidence. I guess what what I will, in terms of summarizing, or one more point to emphasize on this anticipatory action process is the whole aspect of pre-agreed financing. And I want to really emphasize on this point is, if you really want to do anticipatory action, you really have to have this pre-agreed arranged financing system, particularly for preparedness. The anticipatory action that you take on forecast based financing, you have to start preparedness way ahead. So that's something which OCHA, of course, does not invest on, but something that we really are gathering as some lessons learned and advocating for. So I'll go to the next slide in terms of what GBV actors, partner organizations across Bangladesh is now focusing on, and where the discussion is. So what we have is a GBV homegrown coordination mechanism. We call it GBV cluster. And what we are looking into is basically how to integrate this approach in government's national action plan. So we have a small task force with the government where we are discussing, the whole model of forecast-based financing and anticipatory action, because in the government system, there's still, it's not, it's still sort of siloed as humanitarian response, development work, social security, safety net, et cetera, So we are really advocating on that front with the government. And we are also sort of, in that process, we are also looking into joint vulnerability assessment and risk assessment with critical partners like WFP and FAO, UNICEF. So that's something for example, I'll give an example of that is we are trying to develop a common database of the most, of the districts which are at highest risk, a database of household. It would be a common household database where we would be able to rank the most vulnerable households and able to sort of identify them in advance, so that we are able to take anticipatory action with these community people. In terms of setting criteria, what you really have to think as we have done last year, the cluster had its own contingency and preparedness plan, and it was easy to pick up the anticipatory action from that those documents to the anticipatory action framework. However, we learned, that's a good approach, that's a good model, but it's a bigger country, which is largely development. It's a bit of a lot of investment. So we are trying to put together what we are terming as a nexus strategy, where we will look into the ongoing development and recovery initiatives and try to set criteria. We'll decide SRH GBV early action. So the remaining, and I hear the bell, and I won't, but what I would just emphasize on is on the last point, is something that we are really trying to promote is in the anticipatory action is the leadership of women-led and local organization. And there we are struggling a lot in terms of funding, scarcity. But through the cluster system, we are engaging them, we are discussing, orienting them on this approach, familiarizing them with the criterias. So with that, I will stop. And I guess the bell has rung, and I'm happy to answer any questions the panelists have.
Thank you, Romana. Thank you, Farah. We have so many questions from our participants, so we'll start off. Romana, what practical guidance can you share, especially with GBV actors, GBV coordinators who may be involved in the SURF Collective Anticipatory Action pilot for the first time, or those who may want to start engaging anticipatory action stakeholders or actors? So any practical guidance for them based on the lessons learned that you have taken on so far?
Yeah, thank you. I think, I mean, of course, one of the, if you have a system in place already in terms of having engagement with the government, that should be the first and foremost stuff, foremost engagement. Because this is a shift in mindset, as the ERC had also mentioned. So it's that you really need to start that conversation. And then I think what I will suggest to the GBV cluster coordinator is set some criteria in terms of what sort of risk reduction or risk mitigation action could be sort of taken up for SURF anticipatory action framework, because the SURF has a very rigid sort of timeline, right? It's quite a rigid model, if I can use that word. So you can't do everything. So like, for example, we, in Bangladesh, we had the distribution of dignity kits, the distribution of menstrual health management kit for adolescent girls. So and then the RH kits, for the clean delivery kits, or the institutional kits, like the clinical management of rape. So you really have to sort of think through what criteria you would set to pick the kind of action that you would take.
Okay,
so
thanks, Romana.
Yes,
and I think especially for the role of GBV coordination mechanisms, and in your context, for instance, you have other NGOs like Start Fund and even Red Cross and Red Crescent movement who have access to anticipatory funding or forecast-based financing. So it's crucial that the GBV coordination mechanism can also create coherence around early action. So Farah, I have a question, because you've emphasized the women-led aspect of the interventions of Action Aid. And then forecasting continue to improve and become more sophisticated. But how do you see at-risk women and girls and local responders becoming more involved in the decision-making spaces and implementation process in relation to early action and anticipatory action? And I would like to link this question as well with the question from our chat box with regards to how do you work with communities and local organizations, because this forecast information can be quite complex and not easily understandable. So Farah?
Absolutely. I mean, as I was mentioning earlier, that the early warning or any of the messaging was not there targeted for women and or community. So we have been advocating over years of how to unpack the message, how to take it to the community and make it in a way that they understand. So in Bangladesh now, if you come, there's been that advocacy movement, and it has led to messages being conveyed in a way that it's much more community friendly. And one of the things we have to say is the civil society here in Bangladesh is very active. Inclusion of people with special needs. If you come and see our shelters today, and from what the shelter used to be 50, even 10 years ago, it has ramp, it has lighting, because we've been pushing for, to make sure that to bring down gender-based violence in shelters, separate toilets, separate preparation, lighting, ramps, all this has been possible because of that. Now, for women leadership and working closely, we had to invest in them in the sense that women in communities are absolutely capable. They are the first responders. They know what they have to do in those situations. It's not formalized, it's not institutionalized. But if you invest in them, then they can in fact help us. So when we invested post disasters, over a period of time, it led to them being prepared, being able to analyze the risks and then take anticipatory action. So it's not about anticipatory action in terms of financial forecasting or fund, but at least the actions that they can take and what who to go and how to be prepared. So that has been one learning that we found. And I think you also asked about social protection. Am I right?
Yes, yes. If you can take that as well, Farah.
Yeah. So again, the Bangladesh government has a social protection scheme, and it has got 72 kinds of social protection bursaries. But we were able to influence over years how it impacts women, how you need to support. And so now within the social protection scheme, there is a group for climate change impacted and vulnerable groups. So the government has come up with that. I would like to just add that in terms of UN organizations and governments and development organizations, we also have to put out there models of sustainable response. Because what happens is we often are reacting to an emergency or a disaster, and then we are dealing with it. Now, why I say this is we created shelters, homes, individual shelters for families. And instead of the usual run of the tin and the structure, we actually tried to work with the engineering university. We came up with a design and we built those. It did cost us a little bit, but after 2008-9, none of those families, none of those communities have been affected by flood or cyclone. They're not displaced. They're not taking shelter on the embankment, but they have continued and built and prospered their life. So we also want to influence this sector, that innovation and sustainable model is required. It's not just about responding. And how that helps is when there is less poverty, when there is the fear of being displaced, losing your social capital, having to move to new places, girls and women are slightly better off. Otherwise, we see immediately child marriage. Because of insecurity, because of poverty, because of a disaster, we see the increase in harmful practices. But if there's certain level of sustainability and some level of confidence that they will be taken care of. I am not naive enough to say that gender-based violence doesn't happen in peace. I'm not suggesting that, but in comparison, it is better. So I would certainly say social protection is an important area, and if you can influence your governments or the policymakers in whatever capacity you're working, that would be very useful. And when you have a certain bursary or certain cash or money coming in to the women and the girls, then these harmful practices can be deferred.
Thank you so much, Romana and Farah. We have to wrap up now. So just to emphasize, based on the rich discussion from our panelists, we can see how climate change creates chronic and acute stressors, which can exacerbate pre-existing GBV risk factors for women and girls. And we need to address the disproportionate vulnerabilities of women and girls, including those related to gender-based violence. But we also have to recognize that women and girls are powerful agents of change in addressing climate change, and they should be active partners in designing and implementing actions to mitigate GBV risk. This attention to climate change and even climate justice represents an opportunity for GBV actors working in humanitarian crisis, as well as that of the nexus of humanitarian and development programming, to ensure better attention to gender-based violence in both acute and slow onset climate-related disasters. And we can see that anticipatory action initiatives and partnerships offer a crucial opportunity to improve efforts to mitigate and prevent gender-based violence. So we're looking forward to collaborating and leveraging existing platforms. And Lee Ashley has posted the post-session survey. We really want to be in touch with you. So thank you so much and stay safe, everyone. Thank you again to our panelists. Thank you for the rich discussion and for sharing your rich experience to our participants. Thank you, everyone.
Thank you, Pam. Thank you, Pam, and thank you, everybody.